Hello and welcome to the JTech webinar. Today we have two special guests actually from PI Connection, and we will be talking about the blueprint for tomorrow's personal injury clinics. Exciting. If you're into personal injury, this is an essential webinar. I'd like to introduce Sam Frentzas, who grew up an entrepreneur and in an entrepreneurial family, rooted in his father's belief that you must treat a customer well and offer a quality product. This goes back to even when he worked at his father's clothing stores during the summers and while attending La Jolla University. Together with his partner, Walter Bergeron, Sam co-founded the Driving Force Company, a hub for problem solving through their mastermind group and the birthplace of innovative solutions like PI Connection systems. Along with Sam, we'll be honored to have Dr. Scott Tauber, DC, DABCO, and CPC. Dr. Tauber is the CMO of PI Connections and the COO and Director of Education of the American Institute of Personal Injury Physicians, both of which have changed the way providers work with med-legal professionals and automobile insurance carriers in the PI space. Dr. Tauber has over 25 years of clinical and consulting experience and is a national speaker on the topic of personal injury, sharing his expertise with healthcare providers, attorneys, and students. Dr. Tauber has also served as an expert witness on both the plaintiff and defensive medical case side and has been an independent consultant for several years and several major automobile insurance carriers, health insurance companies, and state regulatory agencies. In addition to his extensive clinical and consulting experience, Dr. Tauber is also a diplomat of the American Board of Chiropractic Orthopedics and a certified professional coder. That's a lot. That's a lot to take in. So we are really honored today to have Sam and Dr. Tauber with us. And we will be talking about the blueprint for tomorrow's personal injury clinics. So Dr. Scott Tauber and Sam Frentzas, it's all yours.
Thanks, Dano. Really excited to be here. Dr. Scott is really going to get into the science and technical stuff of what our VMA diagnostic system can do for you and for your personal injury patients. Scott, I'm going to let you go ahead and take over. Missing here is our business partner, Walter Bergeron, who's the nuclear engineer behind a lot of this software. So we're not going to make things too confusing. So we'll just leave it with Dr. Scott to go over all the fun stuff on personal injury. So Dr. Scott, the floor is yours. And let's talk about how we can help these clinics with their PI.
Absolutely. Thank you, Sam. Thank you, Dano. So one of the main components of personal injury cases, and the reason why this is so exciting, as Sam said, is that these are injuries that are going to be in a large majority of your cases, but they're also in a large majority of cases that they don't get diagnosed, underdiagnosed, or totally missed entirely. So what if there was a way, if you could help the attorneys that you work with, and more importantly, the patients that you work with, get compensated for their injuries by identifying injuries that are, as I mentioned, common, but not commonly objectified. And those two are sometimes referred to as AOMSI, sometimes called ligament instability or laxity, and traumatic brain injury. This is going to give you the opportunity to quantify, to identify these objective biomarkers, quantify these injuries in a manner that your patient can get the right diagnosis, the right compensation, and the attorney can then present that to the carrier, creating what we like to call a win-win-win. Win for everybody, win for the patient, win for the provider, and of course, win for the attorney as well. And the other interesting part about this and critical part about this is that we create this causation link from the accident to the injury, which if you're not familiar with the med legal arena is extremely important. You have the ability to do this quickly, consistently, efficiently, and effectively. So the next part of this program is to put these diagnostics into your office. And one of the key components of this is to identify spinal injuries that allow us to see the spine in motion. There's no other technology out there that does this at this level where we can literally see the spine move in real time. And it's the gold standard in identifying spinal injuries. It's going to integrate directly into your workflow. It's not going to take up any more time. It's also FDA cleared, patented, and proprietary, and identifies injuries that others cannot, such as plain films as well as MRI. And it also allows you to keep testing in-house, control the testing, because in personal injury, time is of the essence, and allows you to keep revenue in-house without outsourcing to an MRI facility. So if you're not familiar with this particular injury, and I'm sure many of you are, but if you're not, spinal ligament injury is very common. It's sometimes also referred to as instability, laxity, AOMSI, which stands for alteration of motion segment integrity. That's why it's called AOMSI instead of that, or excessive motion injury or pathology. This is an actual injury that traditional x-rays are literally missing because they don't see the spine moving in real time. And an MRI is not designed to actually identify this injury. So when you do X-ray or MRI, you literally stand zero chance of finding this. Excessive motion gets also cases out of sprain strain. If you know PI, you know that sprain strain has limitations. It's a self-healing injury that the insurance carriers claim that just going to naturally heal in a matter of a few weeks. But that's not the case when you can identify this. You also should know that this is a significant claim value driver, which means that when this injury is diagnosed, it opens up additional windows in the software that allow claims to really maximize and optimize and reach fair value. It's also well supported in the AMA guides, 5th and 6th edition. It's not a new injury. It's been around for many, many years, and it's not a one-off injury. It's going to be in about 70 to 75% of your cases. You just have to look for it. Now, in the AMA guides, here's a few quotes. It states that the loss of motion segment integrity is rare. So a lot of providers have a misconception that this is due to degeneration. It's common, it's out there. Actually, it states very clearly that this injury is rare unless it's accompanied by trauma. So we know this is a traumatic injury. And if a patient doesn't have trauma, then it is going to be rare. So in your PI cases, that's the whole basis of personal injury. They're trauma-based patients. In the cervical spine, if a patient, when they're tested and they go through this process, if they have more than a 3.5 millimeter injury, which is essentially the height of 2/4, that is a rateable injury, which means it's equivalent to permanent impairment. But it doesn't even have to be 3.5 millimeters. Even 2 millimeters in flexion or extension is significant. So just because somebody doesn't have a permanent injury doesn't necessarily mean that they don't have an injury. 2 millimeters is still significant and still can be identified using the technology that we're going to share with you in just a second. As I mentioned, this is well supported in what's called in the med-legal arena a learned treatise, which means it's an accepted text or resource. AMA guides, both 5th and 6th edition, and it's going to be in a high percentage of cases as the underlying pain generator. So when you use incorrect technology, as you see here on the screen, MRI, DMX, or standard plain films, you literally cannot see this injury. Now, some of you may be familiar, well, yeah, there's X-ray out there and I do flexion and extension. I'm going to share with you in just a minute that standard X-ray, the flexion, the neutral, and the extension actually miss 41% of the potential injuries. It's the difference between looking at a photograph of something and watching an entire movie. When you can see the spine move from beginning to end, you have a greater chance of capturing injury. So if we look over on the right-hand side and you see that there's the x-ray of this patient forward flexing, well, could there have been injuries before the actual x-ray was taken that were missed? The answer is yes, and that's what our technology is different. So it's already been featured on the Today Show, and the technology is called the vertebral motion analysis, or VMA. And on the Today Show, the chief medical editor basically said that this is the first time we can see the spine move in real time, and it's the technology of the future. Here it is being featured on the Today Show in one of their segments. And you can see there that this patient is in front of a C-arm, and in the back, we'll give you a better picture of this, but that's where the images are captured. This is all FDA cleared, it's patented, it's proprietary, and you no longer have to outsource for an MRI. You can be able to do this in your office and then go ahead and get a more accurate diagnosis than any other technology. So moving left to right, you see a C-arm is required. You'll need the C-arm. You'll need the proper spacing. And the blue table is what it's called, is where the images are captured. They're in the middle. And then on the far right, you see an actual patient getting the test. Now, this is not new technology. It's been around for a while. And it's not DMX. So sometimes providers go right to, oh, I've seen this. This is, digital motion X-ray. The answer is no, it's not digital motion X-ray because of several factors that you'll see here, including the ability to bolster in the patient and the ability to objectify and, more importantly, quantify the actual injury, which DMX has a problem with and basically is antiquated technology. So let's go ahead and watch this short video here of the actual unit in action. So you can see the patient is bending. Nothing is forcing them to bend, but you'll notice the bolsters. So we stabilized the lower spine and the hips. So we're isolating the lumbar spine in this particular view. And when we isolate the lumbar spine and remove hip movement, obviously we're going to be able to find more injury. When you're asking your patient to forward flex on a standard X-ray, well, you don't know if a lot of that movement is actually coming from the hips. And that's what allows us to capture greater percentage of injury. And you can see here the bolsters keep the patient from bending in this particular example of the lumbar spine. You'll see the cervical spine in just a minute, where you'll see the bolsters stabilizing the upper torso and chest. So the patient is stabilized, and you'll notice that headpiece is not forcing the patient to do anything. They're using it as a guide. When we isolate the cervical spine, once again, we're able to identify greater injuries. And that's what you can do for your patients, for your cases, and for the attorneys that you work with. This is what it looks like when it's marked up. Now, after the patient gets the testing, it's uploaded. We take it from there. Our process is to do the markups down to the millimeter and down to the percentage of angulation. All of our markups are double checked. Once the reports are done on our end, they get sent out to an independent third-party neutral neuroradiologist for validation and verification. And all the reports are then back into the portal and uploaded for you to access and to either go review with the patient and or to send over to the attorney. All of this happens very quickly in a matter of a few days instead of waiting weeks to get all of this done. Now, if you're a literature geek, then you might want to know that this is well established in the literature. Here's one that's in PubMed talking about the video fluoroscopy itself. The video fluoroscopy for symptomatic cervical spine injury following whiplash trauma. This is exactly what a PI case is. And at the end of the day, they're basically saying the imaging modality should be utilized more widely, especially for capturing symptomatic ligamentous instability after whiplash trauma, which is exactly what we're trying to capture. On the left-hand side, this is what I've been referring to. This literature citation, again in PubMed, demonstrates a 41% increase in sensitivity of detecting instability. So even though some of you may be using standard X-ray, you may be missing injuries because of the type of technology that you're using. On the right-hand side, this has been studied and in PubMed that we're able to be accurate to within 0.2 to 0.4 degrees of an angulation injury and down to a 0.5 millimeter in translation, which, you know, if you get out your ruler, that's pretty small. It's also been featured in Spine Journal. In 2013, this was the outstanding paper runner-up, which is a couple of things. First of all, the technology's been out there since 2013. Second of all, if you're working with the spine, you know that the Spine Journal is pretty much the gold standard for anyone working with the spine, whether you're a neurosurgeon, an orthopedic surgeon, or a chiropractor. So to have this published in Spine and essentially the outstanding paper runner-up, this is pretty significant. There's many different technology advantages to using this versus the other technology. We've identified 14 of these all the way down to the patents, to the reports, to the differences, to the objectification, to the Tauber challenges. Everything has been identified here in our 14 different technology advantages over others that are out there. The other injury and the other part of this program is to talk about traumatic brain injury. I'm sure if you're treating any PI patients, you know about TBI. It's going to be in about 50 to 70% of your cases. That's established in the literature. As somebody who educates providers and works with providers on their PI practices, looks at records and cases all day, I can share with you it's probably even higher. It's about 80% of cases. And of those, the majority of those cases are mild TBI. The important part here is mild TBI often goes undiagnosed because of the symptoms. And you don't have to be the greatest physician in the world to identify a moderate or severe TBI. It's those mild TBIs. And if you're sending your patient out for an MRI, a standard MRI, there's literally zero chance of finding a TBI because it's actually the wrong test. And if you ever wondered why, when a patient goes to the emergency department after a motor vehicle crash, that they never come out with a positive MRI or CT for a traumatic brain injury, is because those are the wrong tests. And there's literature studies that will show that they literally have a zero chance of finding. So what we have is QEEG and other ways of getting the TBI diagnosis early into your PI cases, which is crucial. If you're sending your patients out for a neurology appointment, good luck in getting something in a timely basis. Personal injury is all about timely identification of injuries. Time is of the essence. Now you have the ability to keep that in your office and not have to wait weeks or months to get to a neurologist. Now, the patient still may need that. However, we at least now have that injury objectified in the clinical records early, and that's because that's in your office. Same thing, patient gets the test, information is uploaded, sent out to an independent neurologist for validation, and the report is back identifying, yes, the patient has a TBI or they don't, and that's in your portal and ready to go in just a matter of days. And of course, the end user of all of this, we as clinicians and providers are just the facilitators. We have to, number one, know that these injuries exist, look out for them, identify them, objectify them, document them. But at the end of the day, the end user is the attorney. And if you're not familiar with objective findings in personal injury, PI will always be about who has the best objective findings. Subjective complaints, treatment notes, all that's important. But if you can objectify and show somebody that this is where the injury is and give it to them in a manner that the carrier can understand and the attorney can bring to the carrier, you are going to become the go-to doc in your area, because this is exactly what is needed and wanted, and all designed for the end user, which is the attorney, through us as the physicians, as the facilitator. And I'll turn this over to Sam, who will talk a little bit more about the underlying support and coaching, and also some of the other aspects of the program.
Thanks, Dr. Scott, and appreciate all that, because I know how much you love when I talk about sprain, strain, and all sorts of fun stuff when I talk. But again, without the infrastructure built, it's virtually impossible to build it and they will come mindset. So the infrastructure is one of the first things we did when we purchased the company, and an integral part is Dr. Scott Tauber, who's been doing this for the last 20 years, consulting to the top law firms, doctors across the United States, and more importantly, consulting with all the top carriers. So we want to make sure that all the clinics we work with become more marketable to attorneys, but we also, excuse me, want to improve everyone's PI IQ. So again, we make them A players and the go-to clinic for personal injury. Oops, as I jumped ahead there. And then the other part of this program, which we found out that we're able to use, is that you can also use this to identify other injuries outside of personal injury and have immediate cash flow opportunities to diagnose for rehab, spinal decompression, stem cell injections, PRP. We got a Hall of Fame quarterback, Brett Favre here, who having this type of technology is very impressive. When he's done an X-ray, done an MRI, still couldn't find the pain generator, and it was able to get stem cell injections. Because again, right down to the millimeter, able to measure to know where that pain is. NFL quarterback Kirk Cousins, who just signed a $180 million deal. Dr. Tim, who uses this for spinal decompression. So he was outsourcing for an MRI and then bringing the patient back for spinal decompression. Well, that's kind of doing the same thing that everyone else does. So what is going to differentiate you? And that's being able to bring the patient in and run the technology, this unique technology in your office, improve injury location accuracy, improve diagnosis accuracy, and improve treatment option, and more importantly, increase treatment effectiveness and outcome. And at the end of the day, that'll separate you from your competition, because you'll have something that they won't have, because they're going to see the same thing as everyone else. Got here Ryan Jensen working with Dr. Prodromos. He was put back on the field in 6 months. Olympic skier AJ Guinness, same thing, thanks to Dr. Prodromos. Also part of our package includes some attorney referrals and patient outreach. There's zero advertising with this. It's about brand building and really making you the go-to clinic for personal injuries. You can see we already built our own attorney network, and then all the emails, texting, custom videos, lead magnets, and social media is already pre-built. You will get your own PI hotline. You see attorneys have this, so there's no reason you shouldn't have one that runs 24/7, 365, because nothing is more painful than having one of your patients get in an accident. They call their attorney, and their attorney sends them to your competitor right down the street. So let's make sure that does not happen. And every attorney in your network will get access to a HIPAA-compliant document storage and transfer portal. It's HIPAA-compliant. They have access 24/7, 365 to access documents, reports. And they're also, again, nice thing about having a nuclear engineer as a business partner, Walter created the link. So whether you have 1 or 700 attorneys in your network, they will all have their own username and password and link to be able to submit cases, or if they are working with another clinic, to be able to submit for diagnostics. Because again, this comes with area exclusivity, so you will have something that'll be desirable and something that attorneys will want. And then other providers will be coming to you where you start becoming that diagnostic center for urgent cares, orthos, pain management, PTs, chiropractors. Get out of that time for dollars business and be able to run diagnostics into the clinic, because you'll be far more valuable than an MRI. Your clinic will need a C-arm as stated. 2005 or newer GE 9800 is preferable. They're not that expensive. So you can get that for your clinic. This does come with area exclusivity. The build out, which is kind of fun here, because there's 2 days of equipment delivery, installation. The entire office from the doctors to the front desk gets trained. Dr. Scott and I do come out to the majority of all the clinics that we launch, meet with the attorneys, do an attorney presentation. We bring a videographer out there to record all the training, so you have access to it 24/7, 365. And of course, the press release, ribbon cutting ceremony, we'd like to record that and invite the attorneys to come in, see it, and use it. Like I said earlier, the infrastructure is built, so the entire team is there behind the scenes doing the markups, the outside independent neuroradiologist reading, validating, and signing off on the reports. Same with the neurologist for the TBI. Here's some of the CPT codes where we went through the American Academy of Professional Coders, but I broke it down even easier. So if you're going to run an area of TBI and AOMSI, billable services are around 6,600. We did include a 33% reduction request, and the average net per patient for the clinic averages $2,690. You do 1 a day, 20 a month. It's around 53,000 and change net revenue for the clinic. So again, if you're brand new starting out, this might not be a fit for you, but if you do personal injury and you do outsource all the diagnostics, well, this is a chance for us to have a conversation and to be able to add this. And as a member, you do get invited out to our autonomy event in Napa Valley that we do. We have a lot of fun bringing members in from across the United States. Get speakers like Marcus Lemonis. This year we had Dan Kennedy. So it's about empire building. Nobody's in front of the stage trying to sell you anything whatsoever. We have a really great PI CEO dinner, some concerts. So it's a way for us to get together and break bread. Dr. Prodromus was out there speaking about stem cells. Even Tony Robbins is one of his patients. He mentions them in his book, Life Force. Again, it's just some of the fun stuff that we do. Dr. Scott here talking to one of the top law firms in Washington State, some of our ribbon cutting ceremony, and some of our members. All right, and then here we're going to be featured in Top Doc Magazine next month, so we're pretty excited. And then what we do, we also like to donate education to veterans. So for every unit that we sell, we do donate HVAC education to a veteran so they can get plumbing, electrical certification so they can get a job in the HVAC space. So we're pretty proud of that fact. So I know, Dano, you got the link to send out to everybody and the QR code here. So if you'd like to book a demo, see if this is a fit for us to work together, please scan the QR code or click the link, and then you can schedule a live demonstration with us.
Fantastic. Thank you, Dr. Tauber and Sam. And congratulations on your feature in that magazine. That's going to be exciting. Can't wait for that to come out. Do we know when that'll arrive on the
bookshelf? It should come out next month. The delay was because Dr. Scott's got his own page. So that took a little bit of time to get the right pictures and the quotes and all the things. So he took up a whole page on the inside to himself. So that was our only little delay, and I teased him on that. But yeah, it should be coming out in August or September, late August, early September. So we're getting the dates finalized, and then that's going to go out nationwide.
Well, thank you both for coming on and sharing some ideas and really how to improve revenue as well as patient care, and especially in those PI cases. That is amazing.